stomach. So stomach, it is defined as a muscular bag and most distensible part of digestive tube connected to the esophagus above and the duodenum below. And what is its function? It is digestive in function. So it also stores food, reservoir of food and digestive function. And now the location. So as we know, there are 9 abdominal quadrants, out of which the stomach occupies the epigastrium, umbilical and the hypochondric region, which are these. This is the epigastrium, this is the left hypochondric, and this is the umbilical region. In these places the stomach occupies its position. And now talking about the shape and the size, it is J-shaped in an empty stomach. So but it can be variable, right? Like it depends upon the height of the person and the shape, it is variable. And it is distensible and it's a J-shape empty stomach, studied by the barium meal. To take some x-rays of stomach, we use the barium meal. Quantity of stomach is 1000 ml at puke. And now talking about external features. So it has 2 orifices, 2 curvatures, 2 parts and 2 surfaces. Before we read about the external features, we'll take a look of the picture of the stomach, right? So here you see 2 openings. This is the first opening you can see and this is the second opening. The first opening which you are able to see is called cardiac orifice. Orifice is nothing but opening. And here at the end of the stomach, which you are able to see, is the pyloric opening or the pyloric orifice. Okay, so here you are able to see a notch like structure which is called as cardiac notch. After that, you are able to see an upper convex portion. See, this is the upper convex portion which is called as fundus of the stomach. Usually the gas is accumulated here, which is clearly seen in the x-rays taken using the barium meal. Following portion of the stomach which you are able to see is the body of the stomach. Usually the fundus and the body have gastric glands and gastric pits and also many cells. We'll talk about it in the histology of the stomach. So when you descend down, this portion which you are able to see, this full portion, is the pylorus. From here, okay, sorry, this is from here. Whatever you are able to see is the pylorus. Let me tell you, see, this is the pylorus, right? So this pyloric part has it is divided into 2 parts, which is antrum and the canal, which is the pyloric antrum and the pyloric canal, which are separated by sulcus intermedius. Okay, so before we go into the pylorus, let me tell you, this is the lesser curvature and this is the greater curvature, as we all know. So on to the lesser curvature, this is the most prominent thing which you can identify the lesser curvature because of the presence of the angular notch. So on the lesser curvature, you have the angular notch. See, when you draw a line from the angular notch to the below, you can see this all portion which is called as antrum, pyloric antrum, and this portion which you can see here is called the pyloric canal, which are both separated by sulcus intermedius. After that, pylorus and then the pyloric sphincter. This is the pyloric sphincter. It is an anatomical sphincter. You can actually feel it in the dissection. It is a hard sphincter, whereas here you have another sphincter which is called as cardiac sphincter, which I'm able to show you in the yellow color, this one. Cardiac sphincter is physiological sphincter, like it is not that hard, you cannot actually feel it. So after this, the pylorus continues as the duodenum. Let us detailedly talk about each part. So cardiac orifice. Cardiac orifice continues with the lower end of the esophagus, right? And it has a physiological sphincter. And it is present at the level of T11, right? So this is about cardiac orifice. And after that, you have the pyloric orifice, which is opening into the duodenum, and it is present at the level of transpyloric plane. So this is a transpyloric plane in the abdominal quadrants. Here you can also see it. See, this is the cardiac orifice which is present at the level of transpyloric plane. And now it has an anatomical sphincter, lesser curvature. It is concave and it forms the right border, right? See, right side, here you have the liver, and this is the left side, you have the spleen here. So this is right side and this is the left side. The lesser curvature is present on the right side. It forms the right border and it is concave and it is attached to the lesser omentum, and it also has a prominent angular notch. Because of the angular notch, you are able to identify this as lesser curvature. Greater curvature, convex, and it forms a left border. It is attached to the greater omentum and it has a cardiac notch. See, this one which you are able to see here, suppose, see, I'm showing this in blue. Whatever you are seeing, this is a cardiac notch. It is greater curvature is related to the cardiac notch and the lesser curvature related to the angular notch. And now the surfaces. You have anterior superior surface, which is forward and upward, and the posterior inferior, which is downward and the backward surface. And this is due to the second rotation, which you'll learn about it in the development. So in the development of the stomach, if I say about it briefly, it has two rotations. First one is the longitudinal rotation and second one is the transverse rotation. Because of the transverse rotation, you are able to see this anterior superior surface and the posterior inferior surface. Right, after that we'll talk about the cardiac part and the pyloric part. We have divided it based on a line drawn from the cardiac notch towards the left side to the angular notch. Okay, so based on this part, you are able to divide this cardiac part, which includes the fundus and the body, and this pyloric part, which includes the antrum, canal, sulcus intermedius, and the pyloric sphincter, pyloric orifice, everything, which is basically antrum and the canal. Okay, so the cardiac part, it includes the fundus and the body, and in both fundus and the body you have the gastric glands. So gastric glands are nothing but they have cells which are responsible for secretion of HCl or mucus or anything. So in the fundus, it is the upper convex dome shaped part of the stomach. It is commonly distended with gas in the x-rays. Okay, so body is present between the fundus and the antrum of the pylorus. It is greatly distended. So the pyloric part mainly consists of antrum and the canal. We have already talked about it. The pyloric part has pyloric antrum and the pyloric canal, which are separated by sulcus intermedius. So the pyloric antrum, it has pyloric glands. Okay, so which are separated from the pyloric canal by the sulcus intermedius. And the pyloric canal, it is a narrow tube-like part which terminates at the pylorus. See, pyloric canal, right? Whatever I'm showing you in the blue is a pyloric canal, which is terminating at the pylorus. This is the pylorus. So the pyloric canal terminating at the pylorus, which is a narrow tubular-like structure. So this is about the external features of the stomach. After that, we'll see the relations. First, let us see the peritoneal relations. Right? See, this one is the diaphragm, and this is a liver, and here it is the stomach, and this one is a spleen, the small structure which you see on the left side. This one is a spleen. Okay, so if we talk about it, the peritoneal relations. So this is the diaphragm, this is the liver. Between the liver and the stomach, the lesser curvature of the stomach, you have the peritoneal extension, which is called as lesser omentum. Whatever I have shaded this in the yellow color, see, this one is the lesser omentum. This is the peritoneal folding, which you are able to see between the liver and the lesser curvature of the stomach. And between the greater curvature of the stomach and the intestine below, and also the spleen here, which you are able to see is the greater omentum or the peritoneal folding, which is present on the left side. So in the peritoneal relations, we have seen the lesser omentum and the greater omentum. And also, if you see here, between the stomach and the spleen, you have the gastrosplenic ligament, which is a folding of peritoneum, which is called as gastrosplenic ligament. And between the diaphragm, which is also called as which is referred to as phrenic muscle. So between the stomach and the diaphragm, you have the gastrophrenic ligament. So these are the peritoneal relations of the stomach. So talking about bare areas of the stomach, this one which I'm highlighting on the right side, the white, is the lesser omentum, and this one is a greater omentum. So when the lesser omentum is attaching to the lesser curvature of the stomach, some part of it is not actually attached by it. Some part of it is free here. So this is the first bare area of the stomach, and here also on the greater curvature, some part of it is left free when the greater omentum is attaching. So this is the second bare area of the stomach. And on the third bare area, actually this is present on the posterior side of seat. From the posterior view, you are able to see this gastrophrenic ligament is attaching from the fundus, posterior surface of the fundus, to the diaphragm, right? So when it is attaching right there, some part of it is left free. See, some part of it posteriorly, imagine this is a posterior, so see, some part of it posteriorly is left free. So that is the third bare area of the stomach. Visceral relations. visceral anterior relations and the posterior relations. So anteriorly you have the liver, and you have the anterior abdominal wall, and also the diaphragm, which comes anterior to the stomach. So in the anterior visceral relations we have liver, diaphragm, and the anterior abdominal wall. So in the posterior relations, the structures or the organs which are present posterior to the stomach form the stomach bed, which is also termed as stomach bed. So in the stomach bed, so here you have the spleen, and you are also able to see this splenic artery right here. And after that you are able to see this pancreas, and also transverse mesocolon, the left kidney and the left suprarenal gland, and also you are able to see the splenic flexure of the transverse colon. Before we actually learn about this, let us remember a mnemonic. The pyloric has more pits, P and P, remember it like this. Pyloric part has more pits and less cells. The fundus part has less pits and more cells or glands. Now let us talk about the histology. So this is for the fundus and the body, and here we'll talk about pylorus. So first, coming to the fundus, under mucosa it has simple columnar epithelium. Epithelium is simple columnar. So see, under mucosa we are going to talk about the epithelium, lamina propria, and if any glands if present, we are going to talk about it, right? So see, under mucosa we have the simple columnar epithelium, and the lamina propria has loose connective tissue, blood vessels, lymphatics, and the gastric glands have the isthmus. The first part of the gastric gland is called as isthmus, and then this is the neck part, and this is the base. Also cells are present in the gastric glands, so these can be parietal cells, zymogen cells, enteroendocrine cells, mucosa neck cells, and stem cells. Remember this one, the zymogen cells are present only in the fundus. It is absent in the pylorus. Okay, so muscularis mucosa layer is also muscularis mucosa muscle is also present in the mucosa. So under mucosa we have discussed it has simple columnar epithelium, and the lamina propria has lymphatics, blood vessels, and gastric glands. So if we talk about the gastric glands, it has gastric cells which can be parietal cells, zymogen cells, enteroendocrine cells, mucosal cells, and the stem cells. And also you have a layer of muscularis mucosa, okay, smooth muscle layer, this one. And after that we'll talk about the submucosa. Basically in the submucosa we have the connective tissue, the blood vessels, and you have nerve plexuses. For example, in the stomach you have the Meissner's plexus. Okay, this is about submucosa. Muscularis externa, we have already discussed in the interior of the stomach. We have the inner oblique, middle circular, and the outer longitudinal layer of the smooth muscle. And also myenteric plexus is present, just remember it. And the serosa, it is a fourth layer which has a peritoneal covering. And now talking about pylorus. Pylorus has more pits. So basically we have already talked, like in the mucosa we have the smaller depressions in the mucosa, right, which are termed as pits. So in case of pylorus, these depressions are longer, so these are termed as gastric pits, so which are longer gastric pits in case of pylorus. And it has lesser glands, so lesser cells. So the gastric pits are longer and the gastric glands are lesser in number, so no zymogen cells are present here. Coiling of the base of the gland is more. So if suppose this is a gastric gland, the coiling at the base of the gland is more in case of pylorus. So just remember it, pylorus has more pits or the longer pits and the lesser cells, whereas in the fundus you have the more cells but the smaller pits. So here also you have the muscularis mucosa, and the submucosa has loose connective tissue, blood vessels, lymphatics, and the Meissner's plexus. Muscularis externa has inner oblique, middle circular, outer longitudinal layers of smooth muscle, and myenteric plexus is present. Serosa is the fourth layer. So now if you see this diagram, so whatever you are able to see here in the pink color is the gastric pits. So the pits are longer here in case of pylorus. And here you see the gastric glands which are coiled. These are the gastric glands. So the gastric glands are less compared to the fundus, but these are coiled at the base. And so here which are able to see, this one are the crypts. So here if you focus on this fundus portion, we have observed smaller pits and numerous glands. Numerous glands indicates numerous cells also. So here which you are able to see are the crypts. Talking about development. So in the development, you have to remember this 8 points in an order. So first, it is the stomach. It is present as the bilateral dilation on the distal part of the foregut. Suppose this is a foregut. On the distal part of the foregut, there is a dilation on the either side. So it is called as bilateral dilation on the distal part of the foregut. Stomach is attached anteriorly by the ventral mesogastrium and posteriorly by the dorsal mesogastrium. Suppose this is the stomach and you are seeing it from the lateral view. This is the anterior side, this is the posterior side. Anteriorly it is attached to the ventral mesogastrium, attached to the anterior abdominal wall by the ventral mesogastrium, and posteriorly by the dorsal mesogastrium. So this is the attachments of the stomach. And now into the ventral mesogastrium, liver enlarges and the diaphragm develops. So this is the lateral view, right? If you see it from the anterior, here it will be the anterior the ventral mesogastrium, and here it will be the posterior dorsal mesogastrium. So into the ventral mesogastrium, the liver and the diaphragm are developed, and into the dorsal mesogastrium, the spleen is developed. Like imagine, so these are the factors which are responsible for the 90-degree rotation of the stomach. So normally, if this is the stomach and the part which is attaching it to anteriorly is the ventral mesogastrium, into which the liver and the diaphragm are developing, which makes it turn this way, right, to the right side. So the liver has to develop towards the right. So the ventral part along with the ventral mesogastrium is turned towards the right, and the spleen is developing on the dorsal mesogastrium. See, this is the dorsal mesogastrium. Let me show you in the different color. This is the dorsal mesogastrium, and into the dorsal mesogastrium the spleen is developing, which has to turn towards the left side, which is present basically on the left side, right? So because of this, the dorsal part, so see here, so into the dorsal mesogastrium, spleen is developed. It causes the first longitudinal 90 degrees clockwise rotation. This is the first rotation which you are seeing in the stomach. The second rotation is transverse rotation, which we'll see later. So the first one is 90 degrees clockwise rotation because of the development of the liver and the spleen. And the stomach is adjusted in such a way that the ventral part, the first ventral part which we have seen, suppose this is the ventral part and the posterior part is the dorsal part. Now due to the 90-degree rotation, the ventral part is coming towards the right side, and it is called as right part of the stomach, and the dorsal part is coming towards the left side, which is called the left border of the stomach. And later another transverse rotation occurs, which is responsible for the anterior superior and the posterior inferior surfaces. If you look at the diagram, this is the dilation occurring on the distal part of the foregut. This is the esophagus, this is the duodenum, and this is the part where the stomach is formed. So this is the upper part, lower part, and the 90-degree rotation you can see here, because the factors responsible for the 90 degrees rotation are development of the liver and development of the spleen. Liver is developed into the ventral mesogastrium, the spleen is developed into the dorsal mesogastrium, which causes the 90 degrees clockwise rotation of the stomach. So this is rotation around the longitudinal axis. Now talking about rotation along the transverse axis, suppose if we continue from here, this is kind of lifted above, there is a transverse rotation this way, which causes the anterior superior part and the posterior inferior part. So this is about stomach.